In today's video, I'll be discussing electronic prescribing, what it is, how it works, who uses it, and some of the benefits and drawbacks. In general practice, all our records are electronic, unlike some hospitals across the country. Hi everyone and welcome back. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP and currently I work in a completely remote role. If you want to know more about the advantages to working remotely, then check out an earlier video. Before I start, this video is sponsored by Clinics, the UK's official electronic private prescription service. Clinics allows you to send electronic private prescriptions instantly to patients as a code via email or SMS. This code is accepted for dispensing at any pharmacy in the UK or EU. If patients prefer delivery, Clinics allows you to send electronic private prescriptions for nationwide delivery using their UK-wide pharmacy network. It's free to sign up, all you need is your GMC number and you can start straight away. Other features include adding multiple users to your practice account. This includes prescribing and clerical users free of charge, being able to order blood tests for patients nationwide, processing payments such as prescription admin fees for free, generating prescribing activity reports if required for regulatory purposes, for example CQC inspections. Like above, in general practice we use electronic medical notes. I remember when I was a trainee, I would have to wait for the medical notes to come to the ward from medical records. Sometimes there would be massive notes which I would have to carry to the patient's bedside and carry around. The notes were often falling apart and sometimes clinicians or allied healthcare professionals would write in the wrong section. This was because the current entry would be moved elsewhere in the notes. This made things very difficult. So glad to say that I don't have to worry about that anymore. If you are working in the NHS as a GP, you'll be working with one particular system such as EMIS or System 1. You need a username and a password and your smart card to access the patient records. You need your smart card to sign prescriptions once you have prescribed a medication. So for example, if I have consulted a patient and I feel they're in need of a particular medication, I would prescribe it and then sign it by entering my smart card passcode. If you want to know more about prescribing, then check out this 5 in 5 video here. The patient can go to any pharmacy or their chosen pharmacy to collect the medication. If you are working privately or in the private sector, then as above, you could use a system such as Clinics. They provide you with 5 free prescriptions when you sign up. If you want to know more about the private sector, then be sure to check out this video. If you also want support with prescribing, for example, for the prescribing skills assessment or to simply feel more prepared on your clinical placements or working as a doctor, then just click the join button at the top of this channel. You will then be a part of an exclusive community where you will have access to monthly live streams, resources, and tailored support. Now I'm going to talk you through some of the benefits and drawbacks to electronic prescribing. In terms of benefits, number 1, there is no need to sign prescriptions by hand. This has been completely phased out in many surgeries and of course cannot be done remotely. This is excellent as there are no issues with trying to decipher handwritten prescriptions, which could lead to medication errors. Number 2, patients go straight to their pharmacy of choice instead of going to the GP surgery to collect their script and then onto the pharmacy. This avoids prescriptions being lost when the patient collects it or if posted. Number 3, prescriptions can be standardized and this should therefore reduce the number of queries and errors. Number 4, prescriptions can be cancelled, adjusted and reissued as needed. Overall, the process is much more efficient and quicker. Number 5, medications can also be on repeat dispensing, as essentially a bulk prescription can be sent to the pharmacy and dispensed as needed, for example, every month from the pharmacy, instead of having to request at the GP surgery monthly. Some of the drawbacks include 1, there will always be some level of error as it still requires us as humans to use it. Number 2, you need access to your smart card to prescribe. Number 3, there may be technical issues or you may be unable to choose a nominated pharmacy, for example. So that is a brief overview of electronic prescribing in general practice. If you want to know more about prescribing, then check out the 5 in 5 series. As always, if you enjoyed the video, then be sure to give it a thumbs up and don't forget to subscribe for more of the same.